Live by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, thank you so much once again for joining us. We appreciate it.
Hi, guys.
It's been about 2 months now. Schools have been closed. The coronavirus has dramatically changed all of our lives. Public health experts, some of them recently sharing their concerns about what they're calling pandemic fatigue. People are sick of it. They're sick of staying at home. They don't want to do this physical distancing and the face masks, the hand washing. You say what to that?
Okay, so pandemic fatigue is real. I sometimes like to call it quarantine fatigue. And I think the important thing to remember is, number one, it's happening. As we're watching what's called mobility, we're seeing that people in the Commonwealth and around the country are driving further than they have in the past. The key is we want to do it safely. Going outside does not mean go and congregate in large groups. Remember the universal face masking, really important. Washing your hands. We still have to keep some of the basic infection control measures even when we go out.
Doc, let's talk about the immediate horizon. Governor Baker said today that the number of cases statewide continues to decline. We may see some businesses opening to the public on Monday. Can you go through a list of a few changes that you would expect to see inside shops, inside workplaces, that would make everyone feel safer as we go forward?
Okay, so remember, Ed, we still have stay-at-home guidance. We'll see what happens on May 18th, whether that's extended or not. But as far as phase one, what Governor Baker has titled this, he's saying that most of the places that are opening are still the essential businesses that have been open, and then perhaps some non-essential businesses where there's not a lot of face-to-face, people that are in close quarters, really face-to-face with each other. So I think what we want to see when we go into establishments is still some of that distancing, making sure there's a lot of, alcohol gels where we can clean our hands, and ideally we'd like to see face masking if we're within 6 feet of each other. Those are some of the basic principles that I think will protect us.
Are there places that you would avoid right now, you as a doctor? Would you eat inside a restaurant, ride the T, go to the dentist, go to a barber?
Well, Maria, I'm a foodie, so it's going to be hard to avoid restaurants.
I know you are.
We don't know what's going to specifically be open in phase one. We'll have to wait to see what's announced. But I think what's really important is if you have chronic underlying conditions, if you're elderly, you don't necessarily want to be the first one to rush into these places. I think we want to first see the healthier people in there and see how we're doing.
So what about you personally, though, Doc? Would you go into a restaurant if you could socially distance, if it was 6 feet away and you had the appropriate face mask? Would you do it?
I would.
You would.
Dr. But these are individual decisions.
Dr. Ellerin, thank you so much for joining us. It's great to have you as always. And be well.
Thank you, Doctor. Be well. Be well.
Okay. Take care, guys.
Yeah.